Assalamu alaikum wa rahmatullahi wa barakatuh. Hello and welcome to the Open Dialogue. Today we will be discussing expectations. Expectations in any relationships. Why have them in the first place? And also the impact and the effect that the burden of relationships may have on individuals. We will discuss how to deal with this issue and how to cope with the burden of expectations. To discuss this topic in detail with us, we have Dr. Sukaina Asad. Dr. Sukaina Asad is a neurologist consultant in the NHS. She has a special interest in movement disorders, and as part of her work, she's also a trainer and an educator of junior doctors, of junior medical students. Hello and welcome to the program, Dr. Sukaina. Thank you for joining us.
Assalamu alaikum. Thank you for having me on the show.
Alaikum salam wa rahmatullah. We also have with us Hujjatul Islam wal Muslimin, Syed Mohammad Razavi, who is the head of the Religious Advisory Board at the Shia Islamic Education Society in London. He has 40 years of experience in dealing with social and domestic issues for clients, both in the United Kingdom and worldwide. Assalamu alaikum, Syed, and thank you for taking time out for us.
Wa alaikum assalam, and thank you for hosting the show.
So, Syed, today I'm going to start with you. There is a quote by William Shakespeare in which he says that expectation is the root of all headache. Isn't it true that if you don't have any expectations, there will be no disappointment? And expectations only breed resentment. What is your opinion about this?
Bismillah ar-Rahman ar-Rahim. First of all, we need to look at our creation, how Allah subhanahu wa ta'ala has created us. And when we look and analyze our own creation as a human being, Allah subhanahu wa ta'ala has created us as a social being. Social being means we depend on each other. We need each other. We need to assist each other, help each other, and the result is we obviously would expect others to help us in the fields that we are not able to handle or deal, or we are not expert in those fields. So we are interconnected. We depend on each other, and but everything has to be balanced. We should not become totally dependent on others and become a burden for others, and we should not become arrogant that we do not take care of others and become selfish. And this is what Islam teaches us, to balance everything. Islam is the path. Islam is the middle path. Teaches us how to control our desire positively and negatively. In the similar way, expectations should be controlled positively and negatively, and this can only be possible by training, learning, and seeking knowledge and information through divine sources. And then Islam does not restrict us from exploring and doing research and discovering more scientific ways of helping each other as well.
Right. Dr. Sukaina, some of us actually get frustrated when we have the burden of expectation in any relationship and we are unable to handle those pressures of expectation. Do you agree with this, that some people actually cannot bear this pressure of expectation?
So yes, I would second what Maulana just said, that obviously in relationship, expectations can either be positive or negative. It has got either like positive impact or negative impact. As in terms of your question about the impact of negative or negative consequences of relationship, there can be significant consequences if somebody has got like obviously overburdens others through the relations. For example, if I give you the example of parents expectations from children, for example, and having unrealistic expectations or impractical expectations can have consequences like which we see in our practice often, in terms of having dissociative symptoms or functional symptoms, or stresses, anxiety can play a role as well. So this is what we see very, very often in our, especially adolescents who come to our practices, our clinics, with variety of symptoms. And when we look into it, when we dig into more detail, and we find out that this is the consequence of the expectations somehow, or the stresses they had as well.
What are the functional disorders you just mentioned that you see due to trauma or effects as an anxiety or stress that people suffer?
So there, you might have heard the terms like, for example, psychosomatic disorders or functional disorders, or in my field is neurology, which is functional neurological disorders, or dissociative or conversion disorders. These are all same, obviously, phenomena, same thing, but for different names. And that is the psychological disease which leads to physical symptoms, like, for example, having tummy pain, chest pain, headache, having passing out episode. These are just few of them. Or not able to use limbs, for example, unable to speak properly as well. So this is this is how it can present.
Right. Okay. Thank you. Sayed, sometimes adults, for example, Dr. Sukaina mentioned parent and children relationships. Sometimes parents have a lot of expectations from their children, and maybe they project their own hopes and dreams into their children and put this burden on them. What do you have to say about this? Which children cannot bear, and like the doctor said, they may suffer from these symptoms which are indirectly related to this stress that they are suffering.
Again, we have to be very careful in this. There are things that we have to be strict and guide our children in a way that they are kept away from the wrong decisions and wrong path. But
Mhm.
if there is no harm from Islamic point of view, then we should also leave them or give them the liberty of choosing what they want to do. We should only be there as guides and advisors and supporters in the decision they make.
Mm,
Unfortunately, in some cultures, for example, if the father and mother, I have heard many times this. If the father and mother is a medical doctor, they expect the children to also be a doctor. He or she may not like to be in that field. So we unnecessarily impose or force them to get into that field. I just now, I mean, even in the city of London, I have several examples of such cases. A young lady came to me. She said, "I'm interested in studying philosophy, Islam, and learning more and educating myself in these kind of sciences. And my father and mother are insisting that I should become a dentist and doctor. And what do I do? Should I please them, or should I do what I like to do?" Anyway, she was a sensible person. She completed the degree the parents wanted, but as soon as she completed the degree, she didn't go in that field. She left and went and started studying. And then again, the father and mother came. Look, we made so much effort, so she becomes a dentist, and look, she has left it. She is a qualified dentist, but she is studying philosophy now. said, well, let her do what she likes. If you had allowed her to do what she wanted to do, she might have become a very good and knowledgeable philosopher. So why you? As long as they are not doing haram, as long as they are not going astray, and they are not committing any kind of wrong, we should give them the liberty. And of course, we cannot also leave them alone and let them decide to destroy themselves.
So it's a
I mean,
balance that we have to strike.
yeah. Meaning of a human being is that we as an insan, we as a human being, have a responsibility not to be indifferent. We have
Hmm.
to we have to take care of ourselves and others and our future generation as well, but not in a controlling manner, not in a way that we become the decision maker. And, even, for example, if somebody is forced to become a alim din or a religious scholar, if the person is not interested, that person would become a danger for the religion. Same thing for medical field. If the person is not interested in to go to medical science, if you force that person when becomes a doctor will only be after money, not taking care of the need and requirement of people.
Yes, certainly. I mean, like you said, having expectations and not balancing them may lead to controlling behaviors, and controlling
Yeah.
behaviors obviously have their own impact on the individuals that they are suffering with being controlled. Dr. Sukaina, you mentioned psychosomatic symptoms. What are those? If you can explain a little bit more about those.
So as I said, that the psychosomatic condition or symptoms are due to underlying psychological problems that lead to somatic, which means the bodily symptoms, like for example headache or inability to speak properly, inability to function limb, or like obviously you feel that your whole body is not able to function, um,
Hmm.
like tummy pain. These are a few like passing out episode or blacking out episodes as well. These are the various presentation of psychosomatic symptoms, or in other words, what we see functional neurological disorders. Like as we have mentioned, that obviously there are some like expectations, for example, and if it is overburdening other relationships, other relations, and then causing harm and stresses or anxiety, it can then lead to such symptoms as well, and we see it very often as well. For example, everybody's coping mechanism is different. As Maulana has just mentioned the case study, and I had the same case study as well. I have got very dear close person to me who didn't want to come into medicine, but eventually was forced into medicine, and they wanted to do something else, and eventually they finished the degree because of this pressure from parents. After they finished, they said, okay, I have now finished the degree, now I will go back to what I wanted to do, using this degree as well as a step, as a next step. So this is it depends mainly how the individual is. Everybody's coping mechanism is different.
Hmm.
So
Hmm.
yeah, so if somebody is not like, obviously anxiety, stress plays a role as well in here, and then patients can have, like people can have these symptoms, which can present in a variety of ways as well. So and but
Hmm.
we feel, yeah, this is how it presents.
Syed, how can, when parents obviously who do so much in a relationship for their children, if they expect something from their child, um, and the child is not able to fulfill it, how can they deal with this situation? Um, because the parents always have this perfect picture. Not just parents, to be honest, in any relationship, even spouses have too much expectations from each other, and sometimes they have this picture of what their relationship should be like, which both of them don't conform to. And that puts a lot of pressure on a relationship, and eventually, I mean, these kind of expectations can lead to destruction of a relationship. How can people deal with this? So, first of all, how can they talk about it? How do they communicate about it? How can they address it with one another?
There are many ways. I mean, especially as we mentioned before, manipulation should not be there. We should have discussion and understanding of each other, even if it's a parent and child, they should discuss. If it's a spouse, they should also discuss what they are interested in and what they are not interested. Uh, e- uh, Today I received a inquiry about a married couple. Uh, One of the married couple has certain expectations in physical relationship with each other, and the wife is not fulfilling, and that is causing the problem. So I told them, look, you should sit down and discuss with each other what the other person likes and what you like, and then come to some kind of agreement. If you cannot solve the problem, then you need to seek professional advice, maybe of the experts who could create some kind of balance between both of you, and you could learn how to compromise and understand each other. This reminds me of a trip I went to Italy, and I met a couple. The sister was a convert from Italy. He became Shia Muslim, and the brother was from Lebanon. And I was traveling with them, and suddenly the discussion came up, how did they get married? And the lady said, when we got married, immediately after marriage, there was lots of problems and argument and disagreement between both of us. I was saying this is my culture. He was saying this is my culture. I was expecting certain kind of behavior. He was expecting another kind of behavior from me. So we sat down and decided whatever is Islamic, we will accept it. Whatever is not Islamic, we will not introduce to our children from our culture. So they sat down and uh, establish a lifestyle so that children don't get confused. So in our personal life as well, whether we are dealing with our children or spouse or colleagues or student and teacher, and wherever we have to take care of these points. And uh, at the end, seeking advice is not wrong. Quran very clearly says that when you get stuck and you cannot make a decision, then you should seek advice of the experts and act according to the advice that has been given. And the person who gives advice should also be someone who is equal to them in their way of thinking and belief. If one does not believe, I usually say that when you are looking for a counselor, either you should look for a counselor who would not interfere in your ideology and faith, which legally they should not, uh, and or otherwise you should look for equal qualities of an spouse in your counselor. If you have equal understanding and way of living and everything, then probably you would be able to understand each other better.
So communication is key, basically, Maulana. That's what you're trying to tell us.
Yes, it's very
We
important.
need to, yeah, a positive communication as well,
Yes,
because communication also is an art. Um, Dr. Sukaina, obviously, Maulana has spoken to us about spousal expectations, but um, you said to me earlier when we were speaking is that you have many women who present with exaggerated symptoms that you receive in the clinic. Could you elaborate a little bit more on that, and why is that?
So, as like statistics, according to statistics, this functional disorders can happen in anybody. Anybody can be obviously can develop these symptoms, but according to statistics, more women are prone to develop these symptoms as compared to males. And we think, why is that so? Some of the strategy, or some of these side obviously what we say as a risk factors. So those women who have had traumatic past, for example, those who have depression, anxiety as a comorbidities, or those who have had sexual abuse in young age, are more prone to develop these symptoms. And this is one of the explanation, or this is one of the actually more common causes that has been found in literature. Sometimes I feel as well that probably our women, especially, or what else we have found as well, that women with uh, ethnic minorities or women from Asian background are more prone to have psychosomatic symptoms or exaggeration of their pain, for example. And that is also, I feel this is just a observation probably, that they might be, because they are not someone who are always dismissive, their symptoms are always dismissive, and we don't believe them as much as a society as well. We don't listen to them as much as well, isn't it? We don't talk to them as well, as Maulana has said, like the right way of dealing with any problem is to talk to each other and then try and find solutions. But what we see in practice, what happens, we don't talk to each other, especially women. We just try, and women try to just follow whatever is said to them. Usually this is common practice, and I think this is one of the reasons why they have over exaggeration of their symptoms as well. This is one of the observations that we have seen. So yes, but there are various other risk factors as well. For example, biological factors. One is sexual abuse. One is um, witnessing domestic violence as a child also can impact later on. Then, like obviously, this illicit drug use, for example, that is also one of the risk factors as well. Maltreatment, bullying in school, these all are peer pressures. So it's not just relationship between parents and children or spouses, it is the peer pressure as well can lead to these symptoms as well. So there are, and then other sociological factors, for example, having had anxiety and depression, that can lead to these symptoms as well, or exacerbate these symptoms if not.
Syed, in your line of work, you deal with a lot of domestic violence cases between spouses, and it's difficult for women as well, like Dr. Sukaina said, in our Asian settings, uh, with the complicated in-law system, relationship between mother-in-law and daughter-in-law. All of these things come with a lot of burden of expectation, and then we don't listen to each other or communicate with each other. What would you like to say about what Dr. Sukaina just said?
Well, I mean, Islamic solution for these kind of problem is that from the beginning, when you are selecting your spouse, you have to be very careful. That is why one of the requirements of selecting a spouse is to be equal to each other. Uh, Sometimes people, especially in our culture, people think that getting our child married to the cousin will solve the problem because they are both brought up in same family. And I have seen many times cases where one cousin uh, married another cousin and they were totally different and they could not understand each other. They could not live together and they had problems. And same person, when got married to someone totally from a different culture, but with a mutual understanding and ability to work together, they manage to survive that kind of marriage much easily and much easily than other. I have an example of a great scholar family who migrated to Europe, and their daughter was brought up in European environment, in religious European environment, and suddenly they thought that let's get her married to her cousin in Iran, and they did that, and they got her married, and the cousin was brought to this country, and the life became hell for the couple because she was brought up in this environment with hijab and all religious practices and everything. But the cousin who had come from abroad uh, could not uh, bear to see his wife going and mixing with her colleagues and people who work and people who come to her as a student and this and that. It caused so many problems and it ended up in divorce. And then later on, she got married to someone born and brought up in the same environment and from a religious family, and they're happily married and have children. So uh, these examples are very, I mean, clear that we have to be very careful from the beginning of the marriage, from the time of selection of a spouse.
Yes, I mean, sometimes our expectations actually deliver the same results that we expect them to, and therefore lead to disappointment. So having positive expectations is important, but also we need to think about the expectations that we have. So, Dr. Sukaina, how do you deal in clinic with patients who present with the psychosomatic functional disorders, and also the patients who come to you with, for example, low self-esteem or anxiety or stress that they're feeling due to the burdens or traumas that they suffer?
So this first and foremost thing, as I always says, but you must have heard before as well from me, education. So awareness of the condition itself. If they have the awareness of the condition, if they understand, or if they are in acceptance of the condition, then it becomes easy for both patients themselves as well as their doctors or their physicians to help them, or whoever is involved in the treatment. So once they have got understanding, recognition, and they understand that there is something wrong, and they are willing to accept the treatment method, because the treatment here is slightly different. It's not just a medication or pill, we say. Like obviously there are medications as well. For example, if they are having pain or anxiety, depression, or sleep disturbance, we do give medications as well. But the mainstay of treatment is rehabilitation. And what I mean by rehabilitation is retraining their mind to think differently now, to try and cope with the problem. Distractible strategies are used here. Talking therapy, cognitive behavioral therapy by specialists. We also suggest some therapist input like physiotherapist, occupational therapist, speech and language therapist as well. So they all come and obviously play their role as well in order to help patients. And then what we call redirectional, like you must have we often give examples as well, like whenever we are going on a journey, for example, and there are blockages on our way, what we do, we try and find the diversions. Yes. So likewise here as well, our brain is unable to send or receive signals from body or towards the body, and we need to now try and find diversions, redirectional strategies to help cope with these symptoms. So this is what we say, and most of the time, and what another thing as well, what we explain to our patients is that this is a real problem. It's not that they're making things up. It is a real and genuine problem, and we know we don't have anything structurally abnormal, but there is a software problem, as we explain to our patients. And good news is that there is a solution to these symptoms as well, these problems as well. And most patients with positive thinking, they do get better as well. So there are some good, obviously, positive stories as well.
That's an important word that you've used, positive thinking. So, whenever we experience any kind of pressure from our parents or from our spouses, for example, even if our parents are projecting their own dreams or hopes and desires onto us, it's up to the individual themselves to take that in the positive light. Both you and Dr. Sukaina already gave an example What would you like to advise the parents as well as the children regarding expectations?
I think the parents should monitor the child and look at the interests of the child, and then direct the interests of the child in the right direction within Islamic limits. What are Islamic limits? I mean, if you are bringing up your child, for example, Islam teaches us that for the first 7 years, you should let them play and enjoy the childhood. And second 7 years, you should teach them about halal and haram of Islam. So it's during these second 7 years, while a child is also developing, educating, understanding, the parents can discover the interests of the children. Although in some cases you can even discover the inclinations in much earlier stages, but at this stage is very important, from 7 to 14. After 14, the child has already developed, and you should not force and impose the child to go against their wishes. You should be friends and come along with the child in the halal direction that the child has chosen, with your help and assistance and guidance. So the child can have a bright future, not only in this world, in the world hereafter as well.
Thank you. Dr. Sukaina, if you can explain to us the cognitive behavior therapy or some of the occupational therapies that you would suggest to your patients in order to direct their thoughts and to clarify their mind in order to see their way forward and how to deal with whatever situation they're in. What are these therapies and what's the method that's used in them?
So these are the therapies that are delivered by specialist psychotherapists or neuropsychologists. So we refer our patients to them because they have got expertise in that. What they try and do, they try and teach them coping mechanism
Mm-hmm.
and like trying to divert their thought from the symptoms. For example, these symptoms, what happens, these symptoms become exaggerated when you are paying too much attention to them. But when you direct yourself from, let's say, towards away from those symptoms, you would observe that the symptoms calm down. So this is what they need to just learn, that obviously right now the body part, whatever it is not functioning properly the way you want them to function, but there is nothing wrong in it and they can function as well, but they just need to try and learn those strategies to divert their brain, and then coping, like how then they can cope with those symptoms. And while their mind is retraining, they just
Mm-hmm.
need help from all these specialties. They also suggest some mindfulness exercises. Sleep is really important as well. Sleep plays a really important role as well, because often these patients have sleep deprivation, sleep disturbance as well, and that is the most important part in long-term mental health problems as well. And this is what we see, like sleep medicine is also a vast topic as well. So this is really important as well. This is what we often tell our patients. And then symptoms management as well. For example, pain or depression, anxiety. Because if you are stressed or anxious or depressed, then you would not be able to come out of that state of mind and be able to do practice positively. So you have to have some form of medication to help your brain to ease those symptoms before you can able to go to next step. So this is what like obviously, but these specialist therapies are done by trained psychotherapists or neuropsychologists who are expert in their field.
Is that what you call talk therapy? So they would talk to the patient and figure out exactly what it is they're suffering, and then address each and every single problem. Sayed, expectations are obviously also a positive thing and can lead to greatness. If there are no expectations at all, either from others onto us or from us onto our own self, there will be no progress. Uh, do you agree with that?
Well, I would like to give an example regarding dua and from Allah subhanahu wa ta'ala and according to teachings of Ahlebait wasalam. That when there is a hadith narration that when we are praying to Allah subhanahu wa ta'ala, if we are praying with no hope, the dua will not be answered. One of the important conditions for acceptance of dua from Allah subhanahu wa ta'ala is that you believe that Allah will answer my question. You have to have this expectation from Allah subhanahu wa ta'ala that He will answer my dua. So if Allah cannot work without expectation, He wants us to expect and believe in Him that He will help and answer our dua by expecting Him to answer. Then who are we to not to expect from each other? So expectations are not wrong, but they have to be controlled. We should not. I mean, like Allah Subhanahu wa Taala, He is the Creator. He knows. He has the highest expectation from us, but He does not force us to choose Islam. He expects everyone to be Muslim, but He does not force anyone of us to be Muslim. He just advises us. So we have to follow the guidelines by Allah Subhanahu wa Taala Himself. That the way He leads us, we should also lead our family and our society in the similar manner.
We're fast approaching the end of the program, but Syed, you mentioned in the answer to the last question, you mentioned something that within the Islamic boundaries, if your child goes outside of the Islamic boundary and start falling into the wrong things, just out of curiosity, I mean, this is not related to this topic, but how should parents deal with their children in that situation? Should they severe time? What should they do? This is just on this question on the side since it was raised.
Question to me?
Yes, it is to yourself, Syed.
Okay. Yes, I mean, first of all, we have to look where did we go wrong. First, we should discover and try to find out what was our mistake as an elder. And then we should try to sort out that if we cannot handle handle it ourselves, then we should seek expert advice and ask others to get in. Maybe sometimes when I say something to my child may not be accepted, but if someone else with their own different language and different approach say the same thing, it will be digested and taken easily. So uh, change the method, change the person who was directing and guiding, and try to find the reason why the child has gone astray. If it was due to the influence from from outsiders, then we have to, although it's a bit too late, but we should still not give up hope.
I was just about to ask that leading question because Dr. Sukaina did mention that sometimes these symptoms are not just due to family pressures, but also due to peer pressures also can lead to problems. So sometimes it's not a child anymore you're dealing with a grown adult. It's a child to the parents, but that person has grown now and they are beyond this 20 age of 21, where even Islamically they are viewed as a completely independent adult. What can parents do in that case when their children have taken the wrong path, whether it was due to mistakes, due to outside influences? They are dealing with that situation now. Should they sever ties? How can they deal in that? It's difficult for parents to be in that situation. Sayed,
Well, they have to.
Islamically, what should they do? What's their Islamic obligation? That's what I'm asking.
Islamic obligation is to not to give up hope and continue to be there for your child. Continue to be there as. I mean, if you can, as I said, we should not be shy to seek outsiders' help and advice. Some cases, the parents are really busy, or they lack in the type of education that they can give. So there's nothing wrong to seek advice from outsiders, and maybe in some cases professionals like therapists and others. I mean, I have cases where I knew that, for example, a male child, had developed the habit of doing something haram, and I knew that if I quote hadith and narration and say that this is haram and you will be punished and this and that, it will not work. So I advise the parent to take the child to a therapist to look at the reasons for doing that haram in a much deeper way and maybe discover the reasons for it. And in many cases, I have discovered that the therapists have been able to stop the child from doing what an alim or father and mother could not stop him or her from doing it.
I think that's a really important point that you've touched on, is that never to give up hope. A lot of people, when confronted with such difficulties that they never expected uh, to to confront in their lives, because everybody likes to think they have a picture of their children or a picture of life and how it should end up, and when it's not like that, people suddenly give up hope. Give up hope on your children, as you explained, is not something that Islam preaches. And in fact, the the example of Nabi Allah Nuh as well, he did not give up hope on his child till the last moment. He was advising him once he had taken the wrong path. Dr. Sukaina, we are reaching completely the end of the program now. So, what are your final words or conclusion to this topic? Sorry,
If
we
you
can't hear you.
can you hear me now?
Yes.
Can you hear me? Yeah. So yeah, I would just second what Maulana has just said, that yes, if you are struggling, there is help available. So to reach out to help. And therapists are usually really good in this because they are expert. They have obviously learned the skill. So this is how they can help tease out the causes and then eventually find out the solution for a person. In order to summarize, I would just say that these problems are real problems. They are not, people are not making things up or faking things up. These are real problems we need to understand. And once we understand, accept, and then inshallah, with the help within our communities, within our society, we'll be able to help our community in making better place as well. So just
Of,
don't lose hope.
of course, your advice also requires a lot of patience because even the NHS is under-resourced. So even if you decide to reach out for help, nothing happens overnight. Is that correct? Or
Yeah, it is a tedious process as well, yes, and it is quite a lot waiting time as well, and specialists, because we don't have very many psychologists available, and we do struggle in our own departments as well. We do struggle finding one, and there's a long waiting list as well. But in that way, we suggest, like obviously, if you can't find specialists, neuropsychologists, we have got psychologists available, we have psychiatrists
Mhm.
available. So whatever help we have available, we can try and reach out to them while we are waiting for the specialist.
Yes, there are quite a lot of life coaches available as well. I suppose that could be a stepping stone until you wait for a medical specialist. Sayed, why should people persevere into seeking their solution and not give up? And what are your closing conclusion remarks, please?
Well, dunya and the world is surviving with hope. And even Allah subhanahu wa ta'ala says, don't give up. Life is a struggle and we have to we as a parents have to not give up hope, and we should teach the same thing to our children and future generation. Losing hope is it would lead us into what we call depression and other problems as well.
Well, thank you so much for Dr. Sukaina Asad and to Syed Mohammad Razavi for joining us today. I'm very grateful for your time and grateful for your insight and sharing the experiences. Thank you so much, dear viewers, for staying with us to the end of the program. Until the next Open